So what is Salmonella? Salmonella is a type of bacteria that can make people sick. People can become infected after eating food that has been contaminated with the bacteria. It can also spread when contaminated food comes into contact with other foods, surfaces, or hands. Common symptoms include diarrhea, stomach pain, fever, and vomiting. For many people, the illness is unpleasant, but they recover without special treatment. And they may need to rest and drink plenty of fluids while their body fights the infection. But salmonella can be more serious for some people. This can include very young children, older people, and people who are more vulnerable to infection. That is one person health officials are taking this outbreak seriously. Should I be worried about eating eggs or food made with eggs? At the moment, the investigation is focused on finding the source of the outbreak. People should not panic. Eggs are used in many everyday foods. Yes, they can be found in cakes, mayonnaise, sauces, desserts, sandwiches, and many other products. The important thing is to follow basic food safety advice. Wash your hands before preparing food. Keep raw food separate from food that is ready to eat. Clean kitchen surface properly. And make sure foods containing eggs are cooked properly when required. These simple steps can reduce at risk of food poisoning. One person has died, more than 200 people are sick, and UK health experts are investigating a salmonella outbreak that may be linked to food made with imported eggs. But what exactly has happened? How serious is the outbreak? And what should people in the UK know about protecting themselves and their families? Health officials in UK are investigating an outbreak of salmonella. So far, 207 cases have been identified over the past year. However, many of these cases have been reported in just last few weeks. Can you imagine? Just last few weeks, many of the cases. That has raised concern among health experts because the number of people becoming sick appears to be increasing. Sadly, one person has died. The UK Health Security Agency, known as the UKHSA, is now looking closely at the outbreak. UKHSA's job is to understand where the infections came from and how they may have spread. The investigation is also looking at whether the illness are connected to the food made using imported eggs. At this stage, experts are investigating the possible link. That means people should not assume that every imported eggs or every food product containing eggs is unsafe today. The important point is that health officials are trying to find the exact source. So let's find out who has been affected. The people affected by this outbreak comes from a very wide age range. Some of the patients are babies, others are elderly people, including someone as old as 90 years old. That shows that this is not an illness affecting just one type of person. More than 1 in 3 people affected by the outbreak have needed hospital treatment. This is a significant number. And 2 people have developed a serious infection in their blood. This is known as blood poisoning, and it can be very dangerous. So most people with salmonella recover. Serious infection can sometimes require urgent medical care. That is why doctors and health officials want to understand this outbreak as quick as possible. Why are imported eggs being investigated? One of the biggest questions is where salmonella came from. Health experts believe the outbreak may be connected to food made using imported eggs, but there is an important point here. The investigation is still taking place. Officials are trying to find the exact source. They need to look at the different foods eaten by people who became sick. They can then compare information between different cases. If many people who became ill ate similar foods, that can give investigator an important clue. Scientists can also test samples from patients and food products. This can help them see whether the bacteria are connected. Think of it like putting together pieces in a puzzle. One person becoming sick may not tell investigators much, but when hundreds of people become sick and tests show the same type of salmonella, it becomes much easier to look for a common source. Salmonella comes in different types or strains. In this outbreak, health officials have found the same strain in the case they are investigating. That does not automatically prove where the outbreak started, but it gives investigators an important clue. If many people have the same strains of bacteria, health experts can compare the illness and look for something they may have had in common. This can help them work backwards and try to find the source. It is especially important because many of the cases have appeared recently. Finding the source quickly could help prevent more people from becoming sick. People who develop salmonella can experience several symptoms. These may include diarrhea, stomach cramps, fever, vomiting, and feeling generally unwell. Symptoms can vary from person to person. Many people recover on their own, but if someone becomes very unwell, especially a baby and elderly person, or someone who is already vulnerable, they should seek medical advice. Severe symptoms should not simply be ignored. The important thing is to stay alert without becoming frightened. The UK Health Security Agency is counting its investigation. Scientists and health experts are examining the cases and looking for links between people who became ill. They are also trying to identify the food source connected to the outbreak. The goal is simple: find out where the salmonella came from, stop the source if possible, and prevent more people from becoming infected. This type of investigation can take time because officials need strong evidence before identifying a specific product or food as the cause. The important thing is how quickly health officials identify unusual patterns and investigate them. In this case, 207 people have been affected. One person has died. That makes these important public health investigations, but it is also important not to spread fear or unconfirmed information. The investigation is still ongoing. The possible connection to imported eggs is being examined, but officials still need established exact source. What do you think about the Salmonella outbreak in the UK? Let us know your thoughts in the comments. Please don't forget to subscribe to this channel. Thanks for watching. I'll see you in the next video.